Time for that Fox 4 House Call with Dr. Andy, and a lot of people have been paying attention to some recent studies about lung cancer and COPD and other chronic lung illnesses in regards to smoking. And you've gotten a lot of patients asking questions, you know, is there an easy way? Everybody wants that magic pill, just like dieters.
Right, right. And I wish I had it. You know, there are some pills out there that can help, but of course it doesn't take away from the fact that it really requires a comprehensive approach. You know, quitting smoking, we all hear these stories of people who just decide to wake up one day and that's it. They never have another cigarette again. And I love those stories. They're very inspirational. But the unfortunate fact is that most people really need a plan. They need support from family and friends. They oftentimes need counseling, either with their doctor or with support groups. And often medications help very much.
Because smoking becomes a habit. It's part of your daily routine.
It's very
something
addictive.
You're going to miss.
Yeah. Absolutely. It's physically addictive, or physiologically addictive, we call it. The drug, your body actually is addicted to it. And psychologically, you're addicted to it. The habit of putting a cigarette to your mouth, you're right, going with your friends, smoke breaks.
Things like that. So where do you start? If you want to quit, but you're not quite ready for cold turkey, what works best? Patches, pills? What?
Well, again, it takes a huge approach, but when it comes to medications, they really can help. Patches and pills are basically forms of nicotine replacement, and those are that's what everyone's heard about before. And some people say they don't work, but they really do work very well, and they still are probably your first choice. You can get nicotine replacement basically in patches. You can get them now in lozenges. You can get them in gum. You can get in actually inhalers. They look like little cigarette holders. You can even get in a nasal spray that has nicotine in it.
Wow.
And the goal is basically to get a little bit of nicotine at a slower rate, but a more consistent rate to help you avoid the craving for your cigarette. Those work well. However, there's a new drug on the market called Chantix. Chantix has gotten a lot of press. There are some side effects, so it's not the drug for everybody.
Right.
But its success rate, it claims, is about over 55% of people who take it quit smoking.
That's really good.
That is really good. Unfortunately, that's only at about 12 weeks.
Okay.
So when you take that same group of people who use Chantix from 3 months out to 12 months, that number drops to about 25%. And so it's good. It's better than nothing, but it's not as good as using, for example, a nicotine patch with Zyban or Wellbutrin, which is another drug that we've used for a long time to help reduce cravings. So either one of those approaches, nicotine with Zyban or Chantix as an alternative, again, along with support from your family, friends, and of course, you've got to have the drive. You've got to have that desire.
Yep, you have to want to quit. And if you want more information from Dr. Andy about